I'm pleased to be joined today on Health Beat by Dr. Jared Rickert, an orthopedic surgeon with Faith Regional Physician Services Orthopedics in Norfolk, and we're talking about rotator cuff injury. So Dr. Rickert, tell us a little more about rotator cuff injuries and how they're treated.
I'd be happy to. So what your rotator cuff is you have 4 different muscles that come over and form a cuff of tendons over your shoulder. But what can happen, and it can be associated with an injury or just aging of the tendon, is you can get a tear. One of the most common ones to tear is this one right here, the supraspinatus. Okay. And on the diagram, it shows that happening. So the idea of treating it is to really bring back that tendon and repair it where it was natively.
I see.
Okay, so we do that with sutures. One innovation that I'm particularly excited about is a special patch. And I brought a demonstration model, and this is called the Regentin patch. And the idea of it, it's a bioinductive patch which can help form new tissue, and the patch actually absorbs over time. And so it's indicated for those people that maybe have a partial tear, because traditionally those were treated by completing the tear and then doing a full repair. The recovery associated with that is much longer than with this patch. With this patch, you'd maybe be in a sling for a couple weeks and then come out and start rehabbing right away.
It's amazing the technology that's coming along these days.
Yeah, and it continues to develop.
Right. Well, thank you so much for sharing that with our viewers.
All right, thank you.
Thank you. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.